Hi everybody, welcome to Healthline. I am Gregory Zarian. The entire conversation today is all about prostate cancer. However, before we dive into the topic, I want to invite all of you to join us here at Glendale Adventist Medical Center's very own Healthline on social media. Find us on YouTube, Facebook, LinkedIn, and of course Twitter. Everything you want to know, need to know, or are inquisitive about, you can find us right there, and we are there to answer your questions. If you have anything about health, wellness, want to share with us a personal story, find us on social media and we will be there to help you, to answer you, and maybe even bring you in for a show. Now, the conversation, as I said, is all about prostate awareness. And I love my statistics, and let me read you a couple. Prostate cancer is the most common cancer in American men. The American Cancer Society estimates that 1 in every 6 men will develop prostate cancer in his lifetime. According to the American Cancer Society, about 230,000 men will be diagnosed this year. However, if caught early, it is manageable and can often be curable. More than 99% of men with prostate cancer will live more than 5 years from the diagnosis. So joining us today is my very own urologist from Glendale Adventist Medical Center and Star Urology, Dr. Kamyar Ibrahimi. How are you, doctor?
Hey, Greg. How you doing?
Good. Nice to see you.
Good to see you, sir.
Because one thing that we talk a lot about on Healthline is you are the captain of your ship and that you have to have a proper protocol about going in and seeing your doctor. Prostate Awareness Month. Talk to us.
So, Greg, you mentioned prostate cancer and prostate health and some of the numbers about prostate cancer and how important it is for men to know their numbers and specifically when we talk about prostate, the numbers would be their PSA and the importance of them knowing it so they can act on it. As you mentioned, prostate cancer is a very treatable cancer, and it's something that should be paid attention to in all men of all ages, especially if they're younger.
Doctor, I'm going to keep you right there on a cliffhanger. The doctor made a comment about a young age. What do you think is the average age for men to be diagnosed with prostate cancer? Okay, think about it. Go get a glass of water, do some stretching, a few deep breaths in, a few deep breaths out, and that answer and everything you need to know about prostate cancer when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, and it is September, and it's Prostate Cancer Awareness Month. Joining us is rock star urologist Dr. Kamyar Ibrahimi. He has some great celebrity clients. What? Doctor, before the break, I threw out there when you said that there's a young age to diagnosis and an average age for men. First of all, what is the young age?
You know, there is a little bit of controversy in terms of prostate cancer screening and when it should be started.
Because you were saying PSA, and those are the numbers that we as men need to know.
Right. You know, prostate cancer screening, according to the American Urologic Association, who basically is the body that kind of governs the urologists
Sure.
and is involved in licensing of urologists, recommends prostate cancer screening to start somewhere between age of 45 and 50 for men, and to continue for men for as long as they have a 10-year life expectancy.
Okay.
The reason for that is because prostate cancer, by and far, is a slower growing cancer. So patients, you know, aren't necessarily going to die of prostate cancer if they're not going to be living for a long period of time. So if someone has a life expectancy of less than 10 years, I'm talking about someone maybe in their 80s,
Okay.
has heart disease, a few other medical problems, prostate cancer screening is probably not the top priority in that patient. However, in someone who's 45 years old, otherwise healthy, 55 years old, otherwise healthy, not a smoker, you know, maybe a couple of, you know, minor health issues like hypertension or diabetes that are well taken care of, that person in the United States is probably going to live another 30 years if they're 55 years old, because we have such great medical care that we can prevent things or prevent their comorbidities such as hypertension and diabetes to cause them undue problems So they're going to live long. So prostate cancer screening in them does make sense.
The average age for men is what 60, 65?
You know, you talk in the early 60s is the average man who's diagnosed with prostate cancer.
Okay.
But every urologist will tell you a story about a patient that somehow got screened and had prostate cancer in their early 40s. And
What if there's family history?
So right. So now we're talking about risks for prostate cancer.
Okay.
Patients who are of African American descent, obviously if they're older, have a family history of prostate cancer, and also smokers, patients who have a low vegetable diet are at higher risk of prostate cancer. There's a couple other risk factors, mainly one that said if you live higher than the 40th latitude, you can develop a higher chance of prostate cancer. And we think that's because of calcium processing. So some even say...
when you say higher than the 40th latitude, what does that mean?
So, for instance, just north of San Francisco and higher,
Got it.
and north of that.
Got it.
That came from the European experience and Scandinavian countries that have a higher prevalence of prostate cancer in them. So, without making it too complicated, I think it's important for men to see their doctor, discuss prostate cancer screening with their doctor, and if their doctor thinks it's a good idea for them to do a rectal exam and a PSA test on their annual checkup.
So just say somebody is 30 and there is history of prostate cancer in their family. Would you check? Is that too young to start?
I think most people would agree that's a little bit too young to...
And I'm just giving you a roundabout number.
Right. 30 is, in my opinion, too young to start checking prostate cancer. Now, if that person's father developed prostate cancer in his 40s, you should start screening 10 years prior to.
Okay.
But again, 30 or even 35 would be exceedingly, you know, it's an exceedingly rare cancer in those age groups. So therefore, I think that's a little early.
But it goes along with, I mean, with men. Men don't necessarily talk about their health.
Correct.
And you were saying, you just said a few moments ago about the rectal exam. And a lot of guys are afraid to have the rectal exam. And what I've done with you on the show before, and also when I've done Healthline, is I'll look in the camera and say, this will save your life. It's Prostate Cancer Awareness Month. And go to your doctor and buck up and have a rectal exam. What is the stigma behind men being afraid of this?
You know, there obviously for every man, the reasons why they don't want to have a rectal exam is individual, and it's unique to them. But I think it's an uncomfortable test just because of perhaps maybe societally we make it an uncomfortable test. You know, just like we sometimes make breast cancer screening slightly uncomfortable for women. So I honestly don't know. It takes 7 seconds to do that exam. 7 seconds.
Okay, guys, hold on. I'm just going to be really direct. Dr. Ibrahimi just said that to have a rectal exam takes 7 seconds. And that 7 seconds can save your life because most men are afraid. So take a deep breath, close your eyes, and count. 1, 2, 3, 4, 5, 6, 7. Wipe the sweat off your forehead. It's done. More with Dr. Ibrahimi and everything you need to know about prostate cancer when we come back. Don't go away. Welcome back to Healthline. The entire conversation is all about men and prostate health and what we need to know. And this, for 7 seconds, can save your life. You know, it's the social media age, and we at Healthline want you to find us and share with us everything you know and hear from us about what we want to share with you in regards to health and wellness. Find us on our Facebook page, Twitter, LinkedIn, and of course our YouTube channel. It's a conversation about you and your health. Joining us is urologist Kamyar Ibrahimi from Glendale Adventist Medical Center. Doctor, what are signs and symptoms to prostate cancer?
End-stage prostate cancer, which means it's already spread, has very significant signs and symptoms. But very often, patients in early stages of prostate cancer do not have any symptoms whatsoever. They don't have any burning, they don't have any bleeding, they don't have any pain.
So when you say burning, bleeding, and pain, are you talking about that rectally? Or could it be also
urinary pain?
Urinary pain.
Correct.
But could it be both?
It could be both.
Okay.
But typically speaking, patients with early prostate cancer don't have any symptoms at all. And so often I have patients come to my office because they had a PSA that's elevated, and they complain to when I recommend a biopsy to them. They say, "Well, I don't have any symptoms. Why should I do a biopsy?" And it becomes a kind of a challenge in terms of talking to that patient, trying to educate them, saying, you know, a lot of times patients don't have any symptoms with their ailment, just like with diabetes, just like with hypertension. That's why they're called silent killers, because patients most often don't know they have diabetes because initially you don't have any symptoms. And that's the problem. You kind of want to nip it in the butt when it's early so you can intervene and save the patient's life, not when it's too late, unfortunately.
And when you say PSA, that's a urine
It's a
test.
blood test.
It's a blood test.
It's a blood test. It's a simple, less than $20 test that most insurances pay for.
What does PSA stand for?
Prostate-specific antigen.
Okay.
And together with a rectal exam, it can save your life.
Got it. So, and I also love that you said it's a silent killer. No signs or symptoms. We then step into some signs and symptoms. It's the burning, the blood.
Right. You know, bleeding in the urinary tract, burning in the urinary tract are not unique to prostate cancer, but sometimes patients with end-stage prostate cancer can present that way. They can also have their prostate cancer having gone to their bones, so they have excruciatingly bad bone pain. These are obviously patients who come to you with much higher PSA than 4 and 5. And often their PSAs are very much elevated. And in those patients, unfortunately, treatment is limited. You know, I think one of the things we're going to talk about today is prostate cancer, not just diagnosis, which we've talked about, but it's also treatment. Well, when you have end-stage disease, the treatments are very limited. It's, you know, pain control and perhaps hormonal control. But when it's caught early, you have often options in terms of either surgical or non-surgical treatments to getting the cancer under control and monitored appropriately so the patient doesn't suffer any undue harm from the cancer.
Okay, so let's dive into that. Somebody comes in and they are diagnosed with stage 2 prostate cancer and they have to go through treatment. What are some of the early stage treatments of prostate cancer?
So, you know, prostate cancer treatment is very much individualized.
Depending on where it's at.
You know, individualized based on the patient's desire,
okay,
their stage, their age, you know, what their risk tolerances are for a particular modality of treatment and its potential side effects. So you cannot say you're going to be able to have every patient who has prostate cancer treated the same way, because there's so many different treatments out there with varying degrees of side effects, and so patients are given the opportunity to choose after an appropriate amount of education in terms of what they should do.
And a conversation with
their doctor. Exactly. But holistically, anytime a patient is referred to me and I diagnose them with prostate cancer, they're seeing me for a second opinion. And when I say second opinion, is because they've already seen a urologist and they've been diagnosed. They've been told the following, but I also go ahead and spend the 45 minutes or an hour long period of time to reiterate the exact same thing that they've probably read, heard, if not, you know, educated themselves on the media. And so I tell them the same thing. So one option is active surveillance, also called watchful waiting, which means we're not going to do anything for the prostate cancer. We're just going to monitor the rectal exam and PSA every 3 months and perhaps repeat the biopsy in a few months or a year or two, because we understand that prostate cancer is a slow-growing cancer. We have now other tests that can predict how fast it can grow. And so we can monitor someone's prostate cancer, safely, because sometimes intervention can cause them undue harm and side effects.
Oh, interesting. Don't go away. More with treatment and surgery options when we come back. Welcome back to Healthline. The conversation's all about prostate. Joining us is urologist Dr. Kamir Ibrahimi, and before we left, we were talking about a procedure called active surveillance with early stages of prostate cancer. So, doctor, does this just mean that you're just paying attention to what's going on? Can the cancer go away holistically?
It won't go away. I mean, most people would say it won't go away, but there's things you can do to
keep it at bay?
Correct.
Okay.
There's things you can do to improve your diet in terms of more vegetables. You know, soy is very helpful in patients with prostate cancer, and also a vegetarian or a vegan diet can help patients with prostate cancer.
So you're basically staying away from meat.
Correct.
Meat. Okay.
And so you basically monitor the patient and only intervene if there's a change in the PSA and or the biopsy in a later date.
So just say there's a change and we go to another stage.
So the second option is hormone therapy, which means you take away someone's testosterone.
Okay.
And testosterone is the fuel for the fire. You take away the fuel, the fire is still there, but it's going to smolder. It's not going to burn away as quickly. That's a good treatment for patients who are older and aren't particularly good candidates for surgery or radiation. And in the realm of surgery, there is removal of prostate and freezing of prostate.
Well, the removal is when somebody's really advanced.
No, removal is done for patients who actually they're looking for a cure, and we're hoping that it's not advanced.
Okay.
Because if it's advanced, then they're going to need to have multiple modalities.
Got it.
So for surgery, a low impact surgery for patients, which keeps things at bay, but probably it's not considered curative, would be to freeze the prostate, and you can freeze the prostate just partially or its entirety. And that's good for patients who have low-grade cancer and localized cancer, not multiple areas of the prostate involved. And that's a good option. And the removal, again, you take out the prostate and reconnect the urinary tract bladder to the urethra. And you could do it open or robotic. Obviously, with neurotechnology, robotic surgery is the mainstay of removal of prostate cancer nowadays in the United States. However, taking it out in an open fashion is not wrong, and it's a very acceptable means of doing it. It's just in my hands, because of my training, I take it out with a robot. And of course, in addition to robotic surgery, or I should say removal of prostate, another option for cure is radiation with its many iterations. And radiation therapy is also almost equally efficacious in taking out the prostate. It's just your risks of side effects and complications are different when you take out the prostate versus radiation.
Is there anything that men, thank you, is there anything that men can do to create healthy prostates?
What I tell my patients is do what you would do for your heart, and that will take care of your prostate. There's no point of me curing someone's prostate cancer if they're not taking care of themselves and taking care of their heart. You know, what I'm trying to say is, if you do what's right for your heart, your prostate will benefit from that. So a heart healthy diet, you know, more vegetables, less fatty foods, less animal products, and a diet that's rich in cruciferous vegetables is what's considered a heart healthy diet, and it's what's good for one's prostate also. Other risks that one can do to, or other means of risk modification would be smoking, and also
what about drinking?
Intake of alcohol. So I think while alcohol may be beneficial for other things, anything we do should be in moderation. However, I have a zero tolerance policy for tobacco use. I think one of the things that if we could do in the United States would be to ban tobacco, and I think we instantaneously improve the risk of cancer in a lot of our population tremendously. However, it's unpopular.
And isn't it so amazing that cigarettes and cigarette smoke and smoking used to be so glamorized.
Right.
So I did it for 20 years, 2 packs a day. And now I'm over 10 years smoke-free.
Good for you, Greg.
Changed my life.
But the problem is that you know, it becomes habitual and becomes something that patients take a great deal of comfort in. But it's so significantly detrimental to them.
I read somewhere that Kegels can strengthen your prostate. Is that true?
It can strengthen your muscles that are next to the prostate.
Do you advise men to do Kegels as well?
I think if they have a normal voiding, you know, if they have normal voiding habits, they probably don't have to. But if they've had surgery for their prostate or they've had radiation for their prostate, and they have difficulty with some of the urinary issues that they may be having, then Kegel exercises would be one of the things that we use as an adjunct.
And it doesn't hurt because when you're in traffic,
correct.
Do Kegels. Doctor, final thoughts in regards to Prostate Cancer Awareness Month. What do you think the most important? Because you just showed with us health and what not to do.
Extremely easy exam, an extremely cheap blood test can save one's life. Not everyone needs to be screened. If someone is 85 years old and multiple myeloma problems, prostate cancer is not going to be what gets them. However, if one is young, otherwise healthy, prostate cancer should be one of the things that are screened for.
Dr. Ibrahimi, it was an absolute pleasure.
Okay, thank you.
So you heard it from my own doctor. Prostate cancer and your prostate, it's a conversation. Guys, I get that you're nervous and I get that you're afraid and you don't want to go in. 7 seconds can save your life. PSA, it's a simple blood test. And the most important thing outside of diet and exercise is have a conversation. Find out where your family comes from. Ask your dad, ask your mom, tell me about grandpa, grandma, brother. This information can save your life. Remember, the most important conversation you're going to have is about you and your health, so make it a big one. It's all about you and what you bring to the table. Pass everything on that you learned on this episode so you possibly could save someone else's life. We'll see you on social media. Gregory Zarian. Till next time, have a great day.